There's never been anything like this before. There have been about, give or take, about 20 Ebola outbreaks dating back to 1976, and this is by far the largest one. The total number of people who had died from all of the Ebola outbreaks put together before this was 2,000. We're now at a total death rate of more than 10,000. So this is 5 times the size of all the previous ones put together.
The difference that we've tried to make is to try to protect the healthcare workers from Ebola. When the Ebola epidemic happened, we were watching from the US as many of our friends and colleagues that we work with here in Liberia were becoming infected and even dying from the Ebola virus.
We are absolutely grateful for this opportunity to continue to partner with our collaborators in Liberia and our academic collaborators here in the United States to reopen some of the hospitals and clinics, train healthcare workers there.
We lock our hands like this.
With the grant funding that we received, we were able to provide training and protective gear to the healthcare workers at 22 government hospitals so that the healthcare workers knew how to protect themselves from this horrible epidemic. The other difference I think that we've tried to make is to support the training programs so that we could provide faculty to the hospitals and the medical school so that we could keep the medical school training programs moving forward.
I never felt like I was making a great sacrifice to go over to West Africa. I realized I might not come back. Especially when I went over in September, there were some very good reasons to believe I wasn't coming back. And I never lost any sleep over it because, first of all, I owed some Liberians, and I felt like when you go to Liberia and they treat you like a prince, and it's their hour of need, you must respond. And I felt like our institution, who had brought Ellen Johnson Sirleaf, the president of Liberia, here to give the commencement address, I felt like we as an institution owed it to our good name. Our name means nothing if we do not go over and help them in their hour of need.
With the Allen grant, we were really able to try to fill some gaps and holes. And so one of them was in the laboratory side, so trying to rebuild the blood banking so that we could potentially collect plasma from people who recovered from Ebola to treat them and use the antibodies that they have in their plasma. And then the other key thing is we've helped plug some holes with the testing for Ebola. No one wants this to happen again. There needs to be the infrastructure in place to stop it.
I've been working with AXEL for the past 6 months. We're working with all the government hospitals in the country, providing training, supplies, mentorship, and also immediate quality improvement projects.
I've been with AXEL for about 2 months. We go out into the field to health facilities where we do training of health workers, especially when it comes to infection, prevention, and control.
Between the fingers, the back of your hand, and you want to make sure that everywhere is clean.
I'm a nurse, and at AXEL I serve as a master trainer. We can say that to some extent the fear is going to be there, but it's not going to be like before because now we have the knowledge that we need, and we definitely will know when to say this is Ebola or this looks like Ebola, and we need to take much more serious precaution.
I think there's a lot of excitement in the country to get back to business as usual and to really shift the focus to working in healthcare system strengthening.
We are very much equipped to be able to battle Ebola any other time we encounter it.
Just in case it comes back, we are ready and we are really ready to combat Ebola.